So I'd like to chat with you a little bit about bladder cancer. When I meet a patient with bladder cancer, we usually talk about the various stages of the disease, and I tend to characterize bladder cancer as being in one of three distinct stages. The first being a stage in which the disease is non-muscle invasive, meaning it hasn't really penetrated into the deeper layers of the bladder. The second phase is in which the disease is muscle invasive, meaning it's actually gotten to that depth of penetration, but hasn't spread to distant sites. The bladder cancer is limited to the bladder, it hasn't gone to the lymph nodes, it hasn't gone to the lungs, and other places that bladder cancer, quote unquote, likes to go to. The third stage of bladder cancer is where the disease metastasizes or spreads to distant organs. Now, that's a very different scenario, and what I'd like to focus on today is that intermediate phase of muscle-invasive bladder cancer, where the disease is confined to the bladder. One thing that no one would argue is that surgery is really a component of therapy for muscle-invasive bladder cancer. It's really imperative that one meets with the urologist to have at the very least excision of the tumor that's present within the bladder and further characterization. I do believe that the most standard recommendation for those with muscle-invasive bladder cancer is to have a procedure called a cystectomy and lymph node dissection, where the bladder itself is removed in association with the lymph nodes that flank the bladder. One of the biggest areas of debate in muscle-invasive bladder cancer is whether or not there's a role for chemotherapy prior to surgery for bladder cancer. So again, before one has their bladder removed and the lymph nodes adjacent to the bladder removed, we've questioned the investigative community for a long time whether that particular patient should get several cycles of chemotherapy in order to prevent the risk of the disease from coming back. We've had several large studies, one that was conducted by a network of cancer centers that I participate in called the Southwest Oncology Group, that have suggested that not only do we delay the recurrence of disease by offering chemotherapy prior to surgery, but we can actually improve survival by offering chemotherapy prior to surgery for bladder cancer. There are a number of very complicated regimens that are typically offered in this setting. I'm going to use the acronyms for them. One is called MVAC or MVAC. Another very common regimen that's used prior to surgery is called CG, which stands for cisplatin-gemcitabine. I tend to find that either one of these two regimens are suitable to use prior to surgery, and in my discussions, unless a patient really has circumstances that preclude them from receiving these drugs, I try to do my best to encourage patients to undergo this chemotherapy regimen prior to proceeding to surgery. Well, what are the drawbacks of this? Some patients feel that they may actually be having a delay in their surgery that may result in untoward effects. Perhaps the bladder cancer can spread in the interim. I find that that scenario happens but is exceedingly rare. Other patients worry about the toxicity of these drugs. I tend to find that for the short duration of time in which they're administered, these drugs tend to be tolerable, although certainly I would recommend a discussion with your medical oncologist related to the side effects of these regimens. But all in all, I keep coming back to the survival benefit that's associated with chemotherapy prior to surgery. And when you meet with your surgeons to discuss with them removal of the bladder and lymph nodes, I would certainly ask that you also have a discussion with the medical oncologist about the potential role for chemotherapy in that setting.